Hello everyone, and welcome to another episode of the Helping Hand Talk Show. I am your host, Joe Tam, and today we'll be talking about a very serious respiratory disease called emphysema. To give us a helping hand, please welcome to the stage, Dr. Ollie. Hi, Dr. Ollie. How are you?
Hi everyone. Thank you so much for having me on the show. Please call me Alvi.
Your name is Dr. Alvi Olai?
Yes. I know, perfect for our topic today about emphysema.
I love it. So Alvi, you're here to talk to us about emphysema. Please tell me what exactly is this disease?
Emphysema is a chronic obstructive pulmonary disease that affects about 2 million Canadians. It's a long-term progressive disease that essentially destroys the supporting structure of the lungs.
Destroys the lungs? What do you mean? How does that happen?
Well, when a person continually inhales harmful substances, for example, when smoking, the cells in your lungs become inflamed, start releasing inflammatory mediators. Normally, these are good because they get rid of these harmful substances. However,
too much of a good thing is a bad thing?
Exactly. Over time, these inflammatory mediators begin to damage the lung tissue and start to destroy the elastic fibers in alveoli, which are responsible for gas exchange.
So what does that mean if these alveoli lose their elasticity?
Well, think of a brand new rubber balloon. When you blow air into it, it stretches out, and you tie the bottom to keep it inflated. Once you untie it, the elasticity of the balloon causes all the air to come rushing out really fast, and it returns to its normal shape. That's how a normal lung should work. Now, think of those fancy foil balloons. You blow air into them, but when you untie them, the air doesn't come rushing out the same way because the foil balloons do not have the same elasticity. You end up with a sad, deflated-looking balloon that still has some air trapped in it.
So people with emphysema have loose lungs?
In a way, yes. Because the alveoli have lost their elasticity, they have a hard time getting air back out when they exhale, so the air ends up being trapped in their lungs. Then, in the next inhale, even more air is introduced, which causes hyperinflation and further stretches out the alveoli.
Oh, I see. So how will this affect the patient?
Well, this severely affects the gas exchange of the patient. They have a lot of residual air in their lungs, which has carbon dioxide and no oxygen. A characteristic trait of someone with emphysema is a barrel chest look, which is an increase in the anterior posterior diameter of their chest. When you and I breathe, it's very effortless. However, people with emphysema need to chest breathe. They use their intercostal muscles so they can breathe out the trapped air.
Wow! Are there any other symptoms they experience?
You'll hear a lot of coughing and wheezing, dyspnea, sputum production, chronic fatigue, polycythemia, and cyanosis. You'll also find that some patients are underweight, even though they eat the right amount of calories.
That sounds pretty terrifying. So what exactly is the cause of this disease?
The main aggravator is cigarette smoking. 80 to 90% of COPD deaths are related to smoking, including secondhand. Environmental and occupational exposure to chemicals and air pollutants are also a cause. Sometimes there's a genetic component. 3% of cases are caused by a deficiency in the alpha-antitrypsin gene.
So let's say I'm a smoker. What would I have to go through if I wanted to get tested for emphysema?
The main diagnostic tests are pulmonary function tests, which include chest x-rays and a spirometry test. Spirometry findings will note an increased residual volume. You can also take a blood test that measures your arterial blood gases. If you have low oxygen and high carbon dioxide and low blood pH, then that's an indicator for emphysema. We would also perform a walk test, which determines your oxygen desaturation during exercise.
So what is the worst case scenario for someone with emphysema?
There are quite a few complications that can go wrong. One major complication is cor pulmonale, which is hypertrophy of the right side of the heart caused by pulmonary hypertension. Emphysema can cause acute respiratory failure, peptic ulcer disease, and depression and anxiety.
Well, we definitely don't want any of that. Is there anything that doctors and nurses can do to fix this situation?
Unfortunately, this disease is irreversible, so the main goals of treatment are to prevent the progression of the disease, relieve symptoms, and improve quality of life. The most effective treatment is probably the simplest of them all.
Oh, let me guess. A cool drug or surgical technique that makes your lungs elastic again?
Nope. Actually, the most effective treatment is to stop smoking.
What? Really?
Yep. Studies have shown that when smokers with emphysema quit smoking, their rate of pulmonary decline slows down and eventually starts to improve.
Well, it's not always so easy to quit smoking, Doc. What else can we do?
There are some drugs that can be used called bronchodilators that relax the smooth muscles in your airway to improve ventilation. A lot of emphysema patients use oxygen therapy, which is helpful because it reduces the workload of breathing, therefore making it easier on their heart. There are also some surgical options for severe cases, such as lung volume reduction therapy, valvectomy, and lung transplantation.
That's good to know that there are so many options out there. That's all the time we have today, unfortunately, folks. Thank you, Dr. Alveoli, for talking to us today about emphysema.
You're very welcome. Bye-bye.